My name is Heather, and I live in Toronto, and I'm the mom of a child who's being treated through the clinic right now. We've been going through this process of treatment at Sick Kids for just over a year, and I wasn't immediately sure what OPAC was, but I was almost made immediately aware of the fact that there were parents in the hospital that were there to provide support to other parents as they go through that fairly traumatic first few weeks and months of realizing what you're in for. And then as I got to know some of the volunteers, I realized that it was an organization that had been developed by parents who have had that exact same realization that they're not alone. I mean, children's hospitals are phenomenal, and I think the most terrifying thing is just, you're a parent realizing that your child is not okay. And that's scary. So having other parents who know what you're going through, they maybe will know when to be able to judge when you are ready, but just to let you know that they're there. Because, most parents go through a real combination of different treatment scenarios at the hospital. Sometimes your child is admitted and you're staying here for days at a time. OPAC is there in all of the kitchens and waiting areas. They have signs up to say, please help yourself to this food. They have cards out to say, here are the staff that are going to be here at another time. If you're not able to attend at this session, these are the times that we're going to be in the conference rooms having little welcome sessions set up. And the welcome sessions are extremely casual. It's not group therapy. You're not there to have to share anything intimate about yourself or your child's situation. They're just there to be there for you if you have questions, to share food and refreshments with you in case you haven't had a chance to eat. A helpful parent suggested to me at the beginning of this process that meeting other parents will help you develop friendships and help you have some support, but it is a little tricky to know how to go about meeting other parents. And especially in the early stages of treatment, you're hurting and you know that you probably need support, but it's very difficult to put your hand up and reach out for it. So OPAC is great at just having those casual drop-ins where you're likely going to meet another parent. Sometimes realizing what other parents are going through also helps put your own situation into perspective, and you feel refreshed, and that maybe because you're not alone, it's going to be a bit easier. I feel that OPAC does a great job at keeping their self involved in the hospital environment, whether you're at a clinic in a waiting room or if your child's in hospital. Just having that regular availability of their support, I think, was the thing that struck me the most. If I was going through a really hard time with my daughter's treatment and I didn't feel like chatting with somebody that day, I knew that there was going to be another time when they would be there, in only a matter of a few days' time, they would always be there. I don't think you can approach another parent as easily as when you meet them in a group. I mean, when you've attended a OPAC session, it doesn't take any planning. The hours are made public. The OPAC volunteers are there to tell you that when they're going to be there. So I think sometimes not getting advice is just as therapeutic as getting advice. And that's, I think, what is great about organized parent meetings is that you are not necessarily looking for advice, but just the opportunity to talk and have someone else listen. But then also knowing that the OPAC volunteers have gone through many different situations when their own children were being treated, that you can likely ask a number of questions and get a good answer. It's also inspiring to know that they have made the choice to maybe give back some of what they received as when their children were being treated. Pediatric hospitals have a very big job in treating the children and also helping the parents. But the focus is on the child, and many different parents in the hospital that are coming from all kinds of different backgrounds. And navigating how to get some support and help is probably one of the most difficult things that parents face. And so probably because it's difficult and they have to focus on their child, I think that a lot of times parents will put themselves last. And OPAC is kind of there to make sure that the parents will also take care of themselves. OPAC also does a great job of sharing information through social media and through their in-hospital volunteer program. They bring more details to you that you might not be aware of. And just in terms of what other parent advocacy groups are doing, some of the assistance programs that are available to you in terms of getting a little bit of financial support, activities that you can take your kids to that take them right out of the hospital environment and just give them an opportunity to be kids and have fun. OPAC will help you understand how you can participate in those programs as well. I have planned some of my clinic visits around when I'm going to get that cup of coffee, which is great, knowing that likely coming to clinic will mean that there's going to be a friendly person there who won't judge if I go back for a third cup, and sharing treats. It's just a way to help break the ice too. You might meet another parent when you're getting that coffee or tea in the morning. It's important work that they're doing for sure, and I think it's important education for parents to just learn that they're not alone. They may not be going through the same severity of treatment for their child, but that the uncertainty that comes along with knowing that your child is going to be in treatment for a while is a scary prospect. And I think that having the opportunity to just sort of be parents sort of hurting together is important.